Okay, looks like we're live. So as chairperson of the Jefferson County Health Department Board of Trustees, I'm going to call the January 28th, 2021 regular January board meeting to order. And just want to remind everyone, this is a virtual meeting for all of us. So can we have a roll call, please?
Mr. Deal,
Here.
Dr. Henry,
Here.
Mr. Prater,
Here.
Mr. Pig,
I am here.
Miss Davis.
Here.
Okay, great. Welcome, everybody. We try to read the mission and vision at every meeting for the health department. Dr. Henry, would you mind doing that, please?
The mission, JCHD will champion positive health outcomes and behaviors through innovative programs and community engagement. The vision is advancing the health and safety of Jefferson County.
Okay, thank you. Okay, next is the approval of today's agenda. I'd like to ask for one change under new business. I'd like to reverse the order of number 2 and number 3. We're probably going to have more discussion on approval of the bylaws, so I'd like to do that last. So I move to make that amendment.
I second.
Okay, we have a motion and second. Do we have any other discussion on the agenda? Okay, so hearing none, all in favor of that amendment to the agenda, please say aye.
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 Anyone opposed? Okay, so that amendment passes.
I make a motion we approve the agenda as amended.
Second.
All right, again, any discussion? Okay, all in favor of approving the amended agenda, please say aye.
Aye.
Anyone opposed? Okay, great, thank you. So the amended agenda is approved. Next item is approval of minutes and expenditures. First is approval of the December 21st, 2020 meeting minutes, which you all should have gotten in your meeting packages. We have a motion to approve those minutes.
Motion to approve.
Second.
Okay, any discussion on that? Hearing none, all in favor of approving those minutes, please say aye.
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 When opposed? Okay, so those are approved. Next item is approval of the December 2020 expenditures in the amount of, I hope this is correct, $1,053,060.53. Have a motion to approve those expenditures.
I move that we approve the expenditures.
Thank you. We have a second.
Which what report title is that one?
Is that the wrong amount?
No, that's the correct. It's 1220 vendor pay.
That's the only one I hadn't downloaded yet. I apologize.
It's okay.
Okay. Yeah, I'm sorry. I was looking at a different report. I'll second it.
Okay. Okay, so we have a motion and second to approve the December expenditures. Any other discussion on those? Hearing none, all in favor, please say aye.
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 Anyone opposed? Okay, those are approved. Next item is approval of the December 2020 electronic payments in the amount of $544,856.49.
A motion to approve.
Second.
Okay, motion second to approve the electronic payments. Any discussion? Hearing none, all in favor, please say aye.
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 Opposed? Okay, those are approved. Final approval is pre-approval of the February 2021 electronic payments in the amount of $501,640.25.
So moved.
Second.
Okay, motion and second to approve those electronic payments. Any discussion on that? Hearing none, all in favor, please say aye.
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 Anyone opposed?
Mm.
Okay, those are approved. Great, thanks. Okay, next item is our director's report. Director Volmer.
Thank you. Sorry, I was just trying to ask Kristen for a piece of documentation. Just a brief summary of where we stand at this point in time. So numbers have been optimistic. I dare say, you want to knock on wood when you see things kind of going in the right direction, but we're down to, I believe, 87 have been reported in the last 24 hours. And that is definitely a good sign considering where we were about a month ago when we had our board meeting.
Kelly, 87 cases? I'm sorry.
Yes, sorry, 87 new cases
Okay.
since our last report, which would be 24 hours ago. We are in the process right now of setting up our vaccine clinic. So there has been a lot of preparation, a lot of work that has gone into getting our teams ready for doing both mass vaccination clinics and in-house. As you guys have probably heard through the news, we're set, we're ready to go. We're waiting on some vaccine. So we have been working with our local partners, Mercy and Comtree, as well as some of our partners out of the St. Louis Pandemic Task Force to secure vaccine as it becomes available. And I appreciate, again, thank you so much for going through the process on Tuesday to get that started. That will enable us to pull in the vaccine and be able to start getting it in folks' arms as quickly as possible. So with that, yes, sir.
Sorry. I just want to ask a question real quick, and you may cover it, but are we doing a sign up for these, or is there someplace they can go to get on a list? Okay, you're going to cover that? Okay, I'm sorry. I apologize.
No, good question. So what we are doing at this point in time is that there's two ways right now that things are being collected. One is registration lists. So we have a registration list. Big Mercy has done one for the entire state. So Mercy has a list, and then Comtree as well has a list. They are collecting. We are working together with those lists. What happens is when vaccine comes together, Brianne has set up a distribution list for all of the individuals who have signed up for vaccine, and it is sorted by tier. So we're going in the order that the Department of Health and Senior Services has authorized for the distribution of vaccine. And as those tiers become available, that information will be sent out to individuals. If they have not heard, they'll hear from us via email that there are, and basically in that email, it'll say one of the partners, say Comtree, has X amount of vaccines open and they're opening their schedule for Wednesday and Thursday. So then we would push that out to the people who on our sign up list that have the, who meet that criteria and help them to connect with these schedules. Actually just being on the sign up list, what that does is it helps to ensure that you are getting considered and pushed up as a Jefferson County resident and in that line, just because we've seen from some of our partner counties where as soon as those registrations open up, people come from far and wide to try to get the vaccine. And so that helps to prioritize and ensure that we're getting folks in. With that said, we are anticipating getting some vaccine in shortly, but I'm not going to, I don't want to jinx it. So I'm going to just say that right now, it's looking good to be able to maybe be able to start some vaccines. In the meantime, though, we will definitely keep up our support of Comtree and Mercy as they process their clinics. And as we are able to, we're basically just kind of working as a combined system here in Jefferson County, which is a really good format basically for the kind of area we are and how many people we need to be able to immunize. So be looking for information. As soon as we have any confirmations of whether or not we get vaccine, we will be pushing that out via our socials, as well as being able to push out where and how you can sign up to get scheduled for an actual appointment on the emails. Anything else that I want to say? Just again, we had a all staff meeting this morning, and I just wanted to say how wonderful it was to see. We had 80 something people on a Zoom, which thankfully we did not break it, but it was fantastic to see all of those faces for the first time in over a year, and to be able to thank them for their efforts in this past 10, 11, 12 months, whatever it feels like it's been. But they have been doing, I want to acknowledge them publicly as well, as just to say what a fantastic job they've done. Not only meeting the needs of their normal roles, but really pulling through and working through for the COVID side of things. As we embark on our vaccine journey in the next couple of months, there's light at the end of the tunnel. And I know, everybody is really excited about getting back to the day-to-day business of public health, but just want to thank my staff and the community for working through this with us and being part of the process. So that's my report.
Kelly, I know at the beginning you mentioned 86 cases or whatever in the last 24 hours. Do you have the figure for the last 7 days on the rolling average per 100,000 residency?
I can
available
pull that
from your chart. I'm actually looking at it.
Well,
I'd like to see that entered onto public record in front of people that are listening.
That actually is put out on our website every week, as well as it is shared in our stats with Sarah. So that is entered into public record. But as far as the COVID reports, I will pull that up.
So maybe while you're pulling it up, just 50 cases for the week on a 7-day rolling average per 100,000 sound about right?
So we have a 7-day rolling average of 50.86 cases per 100,000 residents per day.
Right.
So that's 114 cases per
day. Right. So if you're looking back at week 47, the number of cases was 87 on a rolling average. So we're down to 50 cases average daily for a 7-day, and according to our 100,000 population. So we are doing, I agree with you, we're doing quite well right now.
So we are anticipating, again, we are keeping the testing numbers up, and they're still continuing to show positive results as far as the measures that we have in place, and definitely are looking forward to getting some more folks immunized and really be able to pull those numbers further down. Yes, sir, Mr. Pig.
I've had a lot of inquiries of where people need to go to get registered to potentially get a shot. Would that be with the online with the health department, with Mercy? Where do they need to go?
So at this point in time in Jefferson County, I would recommend that individuals, if you're on the Jefferson County Health Department registry, you're going to receive information on Mercy and Comtree and each of the ones that are doing theirs. Some folks are registering all three, which is totally fine. I would encourage, if folks have the opportunity and don't mind going to one of the mass vaccination sites, which is coming up in, say, Farmington, or to go up to St. Louis and go to SSM or BJC, to go ahead and look at those opportunities as well, just because we want individuals to take the first chance they get to schedule an appointment. There's the vaccine supply right now. They're kind of changing how they're distributing it. And so as that ebb and flow kind of happens over the next couple of weeks, there's going to probably be some glitches in the system, but vaccines available. They're making more vaccines, so folks will be able to get their vaccine ordered. But I would just encourage them just to be prudent, and if they can, whoever calls them first, go ahead and take that appointment and get their vaccine. The only thing I will say is you can register on as many registries as you want, but please only make one appointment. So if you do get a scheduled appointment, only make one appointment, because they will thaw the vaccine for that day, and they will be counting on you coming in for that. So if you have 2 and 3 appointments, we want to make sure that those other 2 or 3 doses get into folks who need them.
Thank you.
Kelly, I think it's important that we have a strong disclaimer that this is an experimental vaccine. At this point, it's not gone through the animal testing that a vaccine normally has vetted beforehand, and so it came straight to the humans for testing, and it is experimental. So I know there's a lot of optimism out there. We're talking, and correct me if I'm wrong, 95% efficacy. And
very good.
Is that correct? Was that right, Dennis? I heard you mention that.
That's true for the Pfizer and Moderna. Yes.
Yeah. So COVID itself, the percent that it's affecting people that have the comorbidities and 80 and 90 years old is more like 99.3 or 7, whatever % chance that someone's going to get it, and die from it.
Pulling these numbers from somewhere that we might be able to check them as far as accuracy and to be able to look at them as far as the legitimacy of the numbers.
So I think what I'm trying to say is there's a lower efficacy that it's safe compared to, your own human immune system and your T cells that you're building right now.
No, there's no connection between those two numbers, Ms. Davis.
Well, okay, we're looking to achieve herd immunity, and there's 2 ways to achieve herd immunity. One is by allowing the virus to circulate through the population, which it's been doing because we haven't had any vaccines, and now it's peaked up and the numbers are heading back down. So in a form, it has some herd immunity establishing right now. And so when
you notice, looking at the numbers that we have, and if you look at the charts that we have, if you check to see about the time that the mask order went into place, along with the other mitigation measures that as a health department we have taken to protect our community, those all have shown improvements in the exact same time period that those were put into place. So even though the vaccine is available, it is still a necessity that we continue the mitigation measures that we do have. And I do feel that it is extremely important that we are careful about what we present to the community as factual information, especially if it is not taken from a scientific-based and vetted source, because the information that is being provided by the health department officials is.
So since they've been doing the vaccines in the United States, there's been several deaths actually from the vaccine recorded.
May I interject something there? I'm sorry. The vaccines are FDA approval. We need to move on. The FDA takes the handle on this. It's out of our control. We're merely the end spectrum of giving the vaccines.
Let me ask you this. Because I know you want to move on. Is there going to be a doctor in charge on site when Jefferson County employees are going to be administering these vaccines? Is there going to be a doctor on site at every session of vaccines that are being delivered to people's arms? Because there are people dying from this vaccine. It is a fact.
Not near as many people have died from COVID. Please, let's move on.
Well, I'm just asking, is that something we're planning on doing? Because, I'm looking to make sure that we are transparent with the public and that, we're covered as a health department liability wise.
Ms. Davis, all of our actions are covered by a physician.
Is there going to be a physician on site during
Ms.
the?
Davis, there will be a medical provider on staff during the immunization clinics, as well as to do observations of individuals, which is required of this vaccine. For
So not just nurses.
Ms. Davis, it is said there will be emergency medical services, as in EMTs, our medical providers who will be available. Our nurses will be busy giving out vaccine, which we have an enormous demand for at this moment in time, and are trying to get to our residents.
This is no different than the immunization programs we've been running for the last 70 years. So,
Oh, yes, it is.
Those are
They were vetted very, very strictly and animal tested before they put it into humans' arms.
All right,
These vaccines have not been vetted.
Let's move
They're
on.
FDA approved,
They skipped the
Okay.
animal trials. So I'm just saying
period.
there has been people dying from them already. And
I wish I would have been this
actually have
concerned over the
recommendation.
people COVID vaccine or the COVID itself.
We want to be sure we disclose this to the people getting the vaccine as well, so they know.
Nobody knows what's going on.
People should do their own research
We see it
from.
all the time.
A lot of people just take people's word for it that
Let's
it's
move
safe.
on. Next item on the agenda is old business, but there is none listed. So we'll move on to new business. And the first item there is approval to extend the contact tracing contract between the health department and Maximus Federal Services. And my understanding is we just received some information on that. So could you bring us up to date, Kelly, please?
While you're at it, we need to know the cost per month, please, while you're at it.
Ms. Davis, I plan to share that as part of my report.
Thank you.
Go ahead, Kelly.
Okay, sorry, I'm just trying to can you guys see my screen now?
Yes.
Okay. The community impact analysis, which was presented to us by Maximus, is looking at the contact tracing services that they have provided up to this point, looking at their ability to save lives, reduce costs, and empower our citizens through education. Looking at doing case investigation and contact tracing. Again, I'm going through these quickly because I'm getting to me, but basically conducting timely notification to prevent further transmission, ensure successful quarantine and isolation, identify all high risk and close contacts, and ensure resources available for appropriate testing and medical evaluation. When we're looking at the economic burden of COVID, you're looking at the 1 in 5 is the proportion of individuals who contract COVID-19 and get seriously ill. 9 days being the median length of hospitalization, and 51,000 to 78,000 being the average cost of hospitalization for those who are who end up having to be admitted. In terms of our partnership with Maxim, they have provided over 28,302 cases and contacts have been reached. 14,502 cases have been investigated with outreach to 22,850 more. 2,270 cases are currently being monitored. So 2,270 active cases or quarantine cases. 4,955 contacts have been traced. 52 have been attempted. There are currently 281 contacts that are currently being monitored. They are doing this with a workforce of 58 investigators and 27 contact tracers. So looking at where
281 people are currently being monitored. For how much per month are they charging us?
Ms. Davis, again, can I get through my this portion of it, and then I can walk through with you.
Okay.
So with the number of cases that are being investigated. So again, with this, basically at this point in time, when we contracted with Maximus, we were not able to keep up even with the state mandated 0 to 19 population because there were so many cases coming in. At this point in time, they have been able to catch up with all of our youth cases, all of our our older adult cases, and our general community cases, which we were definitely not able to keep up with for a very long time. So they have they've caught us up. And actually, because our cases have been dropping, we are recommending that we reduce the workforce in asking for this extension for a month. The reason that we were asking for the extension for the month was with the newfound variants that are coming that are much more highly transmissible. We feel that giving ourselves one more month of having this in place will give us the ability to not get overloaded or behind if for some reason the variants, which are next door in Illinois, were to jump over and get into our population and cause a spike in cases. With that in mind, though, we were just looking at for the addition of one more month to be able to look at this. As far as the just looking at the why contact tracing makes a difference, again, this is just one of those charts that shows basically one infected person if they infect 3 people. So
our rate of infection is below 1 right now, so it's less than 1, not 3. We'll make sure we get the accurate information here.
Ms. Davis, I appreciate the clarification, and I'm fully capable of being able to report our results. Thank you. So in looking at this, I'm going to stop sharing my screen for a second so I can pull up the other piece of information for, I apologize, I just accidentally shut it.
You do agree with that, right, Kelly? That there is less than 1?
Yes, I do.
All
And
right,
if you look at our information, you will be able to see that as well. So all of the information that we place out onto the website, as well as the pandemic task force, as well as our stats with Sarah, do reinforce all of the numbers that we are putting out. So again, the matters that we have taken, such as masking and social distancing and looking at our hand washing campaigns, as well as our public campaign as far as education, has made a difference. And you can visibly see it in our numbers from the time that they were implemented. So the cost estimate for
and again, that's your opinion, because there are people that haven't wore a mask since the beginning and they still haven't, and that hasn't, changed anything. And the people that were wearing masks before the order was passed were wearing them anyway at the grocery store.
Let the director get through with her report.
Well, I just want to reiterate, this is on public record, so.
Yes, this is on public record.
So where's your vote for not getting the vaccines? And we appreciate that.
Thank you.
In order to be able to, the billing estimate for February 2020 would be $398,812 in order to be able to continue with 30 contact tracers, 15 investigators, and the supervisors that are needed to be able to oversee those, which is 3.
$300,000 a month. Just curious, out of the people they've been calling, how many actually respond to their call and don't hang up on them or not give them information? Is there some sort of
report that I submitted? And if you look at the report that I just sent you, the answer to that is in that paperwork.
Would you say 50%
exactly how many people have been contacted and how many people have been approached? So you see that both how many people have responded as well as those who have been contacted.
So when they're contacting them, they're just letting them know how long to stay in quarantine, et cetera, right?
They're doing the case investigations, which the case investigation is much more than just telling them to stay in quarantine. There is a history form that is taken into account. They are collecting information from them and is submitted into a medical record for COVID cases at the state. So that is part of the investigation process. That's why we're saying 14,502 cases have been investigated and with that 22,000 have been attempted.
So there is a
Kelly, did you have any other information?
No, sir. I do feel that this is especially at a time when we are transitioning over to our vaccine distribution and ramping up for mass vaccination, this is a good time to have just that one extra month in case we experience issues with the variants.
So are we not able to use CARES money since that's run out?
No.
So it'll come out of our budget?
So right now this would come out of our budget.
No.
If
we are not spending $300,000 out of our budget.
Mr. Chairman, may I please finish my comment?
No.
Mr. Chairman, may I please finish my comment?
Yes.
Thank you. So this would initially come out of our funds, but FEMA is reimbursing 100% of funds that are going to be used for this purpose, for this kind of purpose. So if we were to need to be able to reimburse for that, we could do it.
Exactly how much reimbursement have we received so far?
I would have to take a look at the reimbursement from CARES. We were allotted 4.5 million from the county through CARES funding.
And that's all been spent?
Yes, ma'am.
I think we need to slow it down.
I'm going to call the question. Can I have a motion to approve the Maximus contract for the month of February at a cost of $398,112?
I move that we do not hire Maximus an additional month for $300,000. I move that we do not.
Can I have a motion to approve that, and then we can vote yes or no?
I make a motion that we approve extending the contract through February.
Second.
Hold on, guys, hold on. Ms. Davis,
Point of order, I had a motion on the table.
hold on. Ms. Davis made a motion. You need to call for a second. If it doesn't get a second, the motion dies for lack of second. If it
Do we
gets
have
a
a-
second,
Can
then
I
you
ask-
Do we have a second?
I don't believe she made a proper motion.
I did.
Do we have a second? Hearing none, that motion dies. Do we have a motion to approve the contract?
I make a motion to approve the contract.
Second.
For one more month.
So we have a motion
I
and a
would like to
second.
amend that motion. And that motion,
You can't amend the motion.
yes, I can.
The person who
You
makes the
need,
motion.
you need to ask for a second on my amendment. My amendment would be that it's for only one more month, period, no more after that,
That is the motion. It's for 1 month.
period. Not to be renewed again. That
That is-
needs to be added.
You can't do, no.
Ms. Davis, you can't do that. You can't bind the board to do something in a month from now, whenever you don't know what the circumstances are going to be.
Yes, we can.
So we have a
We can
motion.
change
and
it
a-
after that.
We have a motion and a second. I'm going to call the question. So all in favor of approving the contract, please say aye.
Aye.
Aye. Who's opposed?
Aye.
So 3-1. I'm sorry, 4-1. The motion passes. Okay, so according to the amended agenda, the next item is to approve a contract to lease a freezer for the COVID vaccine. And just for people's information, we haven't had the freezer capability to store the Pfizer vaccine. We had ordered the Moderna instead, never been able to receive that. So now we'd like to have freezer capacity or capability in order to have and store the Pfizer vaccine. And Kelly, do you have any other information on that you want to give us?
How much on the lease as opposed to buying one?
Kelly, do you have any other information?
So the lease itself, the individuals are working with us to lease it for $1. The pieces that we do need to take into consideration are that we would need to hire a professional moving company to move it because of the fact that we're utilizing their equipment and to make sure that it is covered under our insurance while it is within our possession. The estimate on the top of that would be about $1,500 total for moving it there and back. The price of the freezer unit itself is about $18,000.
It's unclear. What's the price?
What's the size of the unit?
Mr. Sykes, is it
Fair,
20?
Jim.
I just need to know the price. I didn't hear the price.
The price is $18,000, sir, is my understanding. Mr. Sykes, is that correct?
Correct, yeah.
Price of the lease.
But
The
we're,
lease shows $1 is what it
Yeah.
says on the lease.
Yes.
We're
Is this a
leasing it.
walk-in? What's the
We're-
size of this unit?
We're leasing this, correct?
Yes, sir.
So we're not buying the unit?
No, they have offered to allow us, in order, because the individual firm that this is through has a lot of staff that live within our area, and they wanted to be helpful to the community. And so they had offered this as a opportunity for us to be able to get vaccine in.
And
Sorry,
the
but I
lease-
missed
the lease
the
is
monthly
for
amount.
a dollar total or a dollar per month?
$1, I believe. Is that correct, Steve?
Yeah, I think it's $1 through the end of June, I
Right.
believe is the term of the lease.
So we'd
And then
have,
after
we'd
that,
have
what?
the dollar lease plus the $1,500 moving
Well-
expense, correct?
Well, can I clarify
Please
the
do.
move? Yeah, actually the $1,500 it's 500 to pick up the unit, and then it'll be 500 to return it when we're done with it. Plus there's another 500. This type of unit for the data logger and the probe for the data logger is a $500 item. We would have to buy that anyway if we bought our own unit, but it's a special data logger that would have to be used.
That's what's used to ensure that, as I'm sure you know, Dennis, but just
Temperature.
the others, that's used to ensure that the vaccine stays within its mandated.
So-
temperature.
So the cost we're looking at is a dollar plus the 1,500?
Correct.
Okay.
Not bad. Just curious, is this a large unit, like a walk-in unit, or?
No, it's not a walk-in. It can be rolled in. It's larger than your home style refrigerator, but it's basically the same size or a little bit bigger than a home style refrigerator. There is-
It's a Sub-Zero, right?
Yeah, it's ultra low is what it's called.
Okay.
It will maintain the temperature needed for the Pfizer vaccine.
So I take it we would get a certain amount out for the day that's going to be used because people have signed up ahead of time, knowing how many, and that many would be thought out to use that day? Curious?
So actually, as part of the process of doing the clinics, they would actually do them probably not even all at once at the beginning of the day, so that way they can ensure that there's no wastage. But yes, this gives
What
them
if
more flexibility with the vaccine.
So I'm thinking they need to be fully thought out before they're used, and they'll be sure to do that, right? Because, it would be not beneficial to get a frozen vaccine.
I think it would be difficult to give a person vaccine.
Mr. Chair, I'd like to make
Gotta
a
be
motion
careful.
to approve the contract,
Tim,
at least for the freezer.
Tim,
Yes.
I have a suggested motion. Let me read that to you. So the motion would be to ratify execution of the agreement signed by the chair.
And Dennis freezes.
Obviously, it still needs to be ratified by the board. So that would be the motion, and I'm sorry. So,
Mr. Deal, do you mind repeating the motion? Your screen froze,
okay.
Yes.
just for the record.
Okay, I'm sorry. So a suggested motion would be ratify execution of the agreement signed by the chairperson.
I'll second that motion.
Okay. Any other discussion, questions?
Just to clarify, this is going to go through June for $1 a month plus the delivery fee.
Dollar total.
Okay, so it's not going to change after June?
Dennis, clarification, item 5 on page 2 of the lease does say it shall continue month to month until June 30th, 2021. So it does look like it is $1 a month when you look at.
It sounds like they're wanting to donate it, so we don't have to worry about a surprise at the end, like it's going to be $1,000 a month or something.
We're not purchasing it, so that's not a concern.
Sounds
Steve-
good.
Steve, do you know, is it $1 or $1 a month?
I'll have to
It says the
get
dollar.
clarification. I thought it was $1 till the end of the term, but
It
I
says
see where
right
he's
here-
saying.
It says right here, lease to lease and the leasee leases from BRDS, the equipment upon the terms and conditions set forth in this agreement for the sum of $1 for the term of the lease.
And the term is how many months?
Through June 30th, 2021.
Right. Okay.
Okay, I mean, obviously, that's not a big dollar amount either way, but I think we should just make sure we kind
I'll
of
check.
resolve that. Okay, so we have a motion and second. No other discussion. All in favor of ratifying the lease, please say aye.
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 Opposed? Okay. Thank you. That passes 5-0. Okay, our final open session item is approval of updated bylaws. I'd just like to say that for everyone's benefit that board members went over the bylaws in detail already in a closed session in November. The changes that were discussed and requested at from that discussion have been made. And what we're going to do there, the bylaws are divided into sections. We're going to do a roll call vote for each section. And if it's not a problem, I'd like to ask our attorney, Christy, to announce the sections, give a brief description of those, and then we'll have a roll call vote for each section. Christy, can you do that, please?
Mr. Deal, I have a item I'd like to bring up. It's a scribbler's error that I found. I know it's not a big deal, but I would like to go ahead and make sure I get it pointed out so we can get it corrected. On page 20, paragraph 2, where it says the letter of outcome will include A, the include and A are together. So if we could fix that in the scribbler's error, at least that was on mine. I don't know if it's other people's, but thank you. I know it's just one of those things that I did go over it verbatim. So thank you.
Tim, what are you referring to? I'm sorry.
It was in the bylaws itself. It was on page. You already got it, Christy. Thank you. It was just a scribbler's error. It was no big deal. I just wanted to clarify and get that taken care of.
Okay, I'm sorry.
No, that's all right. Thank
you.
Okay, so what we're going to be voting on wasn't given to us along with this agenda. You expected us to go back to November and look for something that we had that was brought up back then. I don't think that's a good way to. I think we need to think ahead of time.
Ms. Davis,
was that on today's email?
One at a time, please. Christy.
Was it on today's email, or were we supposed to go back and find it?
May I answer your question, Ms. Davis?
Yes, please.
We went over this at length in executive session in November. I took note of what changes were running, including your requested change that meetings, visits be accomplished once a month by rotation of board members. I included that in the draft that was sent out today. That's the only change, other than a couple of typographical issues. That was the only substantive change that the board requested. So what you have in the summary that I sent you that is privileged and not to be disseminated outside of the board's reading is a summary of what we discussed in November to make sure that you understand it, which is like a recap of what we talked about in November. So what you're going to be asked to vote on today is the changes that were presented and explained with the board in executive session back in November.
So it was not in the email that we all received this week about this meeting. It is not in that.
You got it in November.
I'm sorry.
You received it in November. You've had it for 2 months.
Because I printed everything out for today's meeting. It's not in there.
Ms. Davis, it was in your packet in November. You've had it for 2 months, and we had the chance to discuss it back in November.
We just found out 2 days ago that it's on this agenda, that it's going to be discussed.
Actually, Ms. Davis, I advised you in December's meeting that we would be voting on the changes that we had talked about in November. I talked about that in December's meeting, so that I reminded the board to go ahead and go back and review what we had done back in November.
I, for some reason, did not hear that.
I'm sorry that that was.
I'm a little bit taken back that we're going to be doing something like that without having a bunch of papers in front of us that we could
Ms.
be looking
Davis, you have them. They're in your November packet. And then I also sent you them again today and a comparison document so that you can pull those up on your computer screen. You can go through those with me, or I can just talk about the summary that was sent out.
Well, go ahead and make sure that you read it clearly so that we can understand it. Go ahead.
I would be happy to read it clearly. If you have any questions as to whether or not you're understanding, you're more than welcome to ask me.
Yes, ma'am.
If, however, you're asking me for legal advice, we need to take that into executive session, Ms. Davis. So section 1 of the bylaws, it just pertains to the organization of the health department and the center and the board. So to remind everyone what we went through in that particular change is we added the description of the board's mission. We added the scope of the authority of the board, what the board is allowed to do under statutory framework. Clarified the terms of the members, how long you all sit for your term, how to remove members. The current version of the bylaws does contemplate removal, but it does not provide any type of protection for the member who is possibly going to be removed. So we wanted to make sure that that was a fair process for the member that was in question. We explained what that process would be whenever we met about this in November. We also added the duties of the board and its members and clarified what can be delegated and what cannot be delegated to the director, so that it is clear what her obligations and responsibilities are versus what the board members' obligations and responsibilities are. We clarified and added in language regarding conflicts of interest, clarified that that there are meeting attendance requirements for board members. So, and this is all touched on. Your old bylaws were very, very vague and very basic and didn't provide a whole lot of guidance as to what was required of the board members. So we basically went through these and we spelled this out so it was all clear and fair. Nobody can say they didn't understand what their responsibilities were. We added that there was a maintenance of confidentiality requirement for all of the board members and for the executive director. Where there were references to a chairman, we made that neutral chairperson. That's throughout the bylaws, just to make that gender neutral. We specified what the duties of the chairperson and the secretary treasurer are, and specified also that there can be a correspondence secretary who is not elected, and outlined what her duties are. And right now that is being served by Ms. Pinkley. And then also in section 1, we added in what the standing committees of the board are. That is what the current practice is. So we wanted to go ahead and put that into the bylaws so that could be codified within the bylaws. So those are the changes that we made to section 1. If you want to go ahead and if someone wants to make a motion to adopt the proposed revisions to section 1, we want to do this section by section so that the record is clear.
Absolutely not. I think we need to read specifically what you're asking us to vote on. Not you just generally covered it. We need to hear exactly what it is.
Ms. Davis, you did hear. In November, you heard. And you asked.
The public has not heard. I'm sorry, Christy. They haven't heard, and they need to hear.
Well, Ms.
And
Davis,
I need to hear because I don't have it in front of me.
Ms. Davis, respectfully, the public doesn't get a vote on whether or not these bylaws get changed. These are the bylaws.
They don't need a vote, but they do need to hear what's being changed because it has to do with their health board.
They just
and I need to hear. I don't want to hear something in general. I want to hear specifically what you are asking to change. Why don't you go paragraph by paragraph?
Ms. Davis, I did that for you back in November.
No, you didn't.
Respectfully, ma'am, I did. And I incorporated the changes that you asked.
You did not.
I make a motion we approve section 1 organization.
I second the motion.
Okay, we need a roll call vote, please.
You're supposed to, point of order, sir. You're supposed to ask for a discussion.
We just had a discussion.
You still have to, there's a motion on the floor, sir. And you, after it's seconded, you asked for discussion.
You asked for discussion.
Okay. So in discussion, I want to please have you read what is in specifically word for word what you're asking us to vote on now, and not refer back to a meeting in November. I don't have it in front of me. I want to see, I want to hear what is in it specifically.
I
Ms.
would
Davis.
like to add to the discussion. We received this. We went through it in November. We received it. The rest of us have it in front of us right now because we're prepared for this meeting. I would like to continue with the vote.
Why don't we table this until the next meeting so that I can look it over and have it in front of me as well, so Christy doesn't have to read through the whole entire thing. Why don't we do that, to be fair to me?
Well, Susie,
was-
we
it was
all
sent to you at-
prepared for this meeting. And
What
we
is the
all
big
prepared.
hurry? What's the big hurry?
We've been dealing with
Unless you guys are trying, unless you're trying to do something
Move to call
that
the question.
is, because I particularly remember the meeting having a particular thing in it that stated that that the other board members could vote off an elected board member for whatever reason, and you know, there's nothing showing any kind of process in this, and I'm not gonna sit here and allow my board to try to pass something that I need to see fully. I'm sorry, I need to see it, since
First of
she's
all,
made
let's
her
clarify,
changes,
it's not
her
your board.
amendments, all her
It's
little.
not your board.
I need to see it. I need to see it.
It's the people's board, not
Be
yours.
fair to me, guys. That's all I'm asking. I want to see it. I don't have it in front of me. I want to see it. At the very least, put this off till next month, please, so that I can see all that she's talking about, so she don't have to read the whole thing. Otherwise, I need her to read the whole entire thing.
Can
Ms.
you not?
Davis, actually,
Christy,
Ms.
what do
Davis?
you recommend, Christy?
Well, so we went over this in detail, line by line, back in November, and we did table it back in December in order to give the board additional time to go ahead and review the suggested changes and to give me any comments or questions. Ms. Davis, you do have it in front of you. It
How
is in-
can I give you any of my suggested changes or recommendations if I haven't seen it since that meeting?
Ms. Davis, you have had it
made
for 2 months.
changes to it.
Ms. Davis, you've had it for 2 months, and if you don't like the process that is in there, you are more than welcome to vote against it.
That's not fair, Christy. I need to see it before it gets voted on.
You
Okay.
have seen it, Ms.
What's
Davis.
the big hurry? What
Ms.
is the
Davis,
big
you've already
hurry?
postponed this another month.
One more month. This is not, it's not going to make us or break us. One more month, to be fair to me.
Move to
I
call.
I know
the
you guys
question,
don't
please.
like me, but come on. It's not fair to me to vote on something that affects me, because I'm the one that would be like, you guys would target me and try to vote me off.
Ms.
I want to
Davis,
see what's in it.
under the current bylaws, you actually have less protection than what I've drafted in these revisions.
Well, I want to see that. I want to see
You
what you
have
drafted.
You have
Already
seen
have.
it.
You have seen it, and you've had it for 2
I have
months.
not seen it. I have not seen it. You
Well,
only
that's-
talked about it at that November meeting, and I want to see it. I want to read through it again before we vote on it. That's what I'm asking for. That's not asking too much, you guys.
There's a
Mr. Gill,
motion
you
and a
have an
second
active
on the floor.
Understand,
If any one of you hadn't had time or hadn't seen it,
All
or
right.
for whatever reason,
All right,
you hadn't,
we're
I-
gonna
it
call the
would be
question,
fair
the
to
vote.
just wait another
We're
month.
gonna vote on the motion and the second that are on the table. So we need a roll call vote, please.
Before you do that, sir, I want that part read out loud to the public. What is concerning removing a board member that has been elected? I want that in particular. I'm not too concerned about anything else in it other than that at this moment. But I want that, I would like for that to be read out loud so that I can hear it and they can hear it.
Ms. Davis, these are the bylaws of the Jefferson County
You're
Health Center.
asking to change the bylaws
That's correct.
for this health board.
That's
I
correct.
want that read out loud
It's
to
been
us
done.
before we vote on it. At the
That's-
very least,
I'm
That's
happy to
been
read it out
done.
loud for Ms. Davis. I'm happy to read it out loud for Ms. Davis. It's exactly what she
Okay.
saw in front of her in November, and it actually provides for more protection than what she has right
I
now.
appreciate that.
Ms. Davis, you asked me to read it. Please let me
Yes.
read. Removal. A member who fails to adhere to his or her roles or duties and responsibilities is subject to censure by a majority vote of the board. If after censure the board member fails to perform his or her duties, he or she is subject to removal from the board by a majority vote of the board following a meeting during which he or she is presented with allegations supporting removal and provided an opportunity to respond to the allegations. Upon majority vote of the board to remove the member, the removal shall be reported to the county executive of Jefferson County for the appointment of a replacement to hold the office until the next municipal election, when such vacancy shall be filled by election of a trustee to serve during the remainder of the term of such trustee's predecessor.
How convenient. When you don't like a board member, just remove them. How about
This
the people
provides
that
you-
voted the person in? This is not okay. That needs to be removed.
You have a
That's
vote, Ms. Davis. Roll call, please.
It's not okay. In fact, to change bylaws, it should be 3/4. It should be not just a simple majority.
Your roll call. Let's go.
Mr. Deal,
Unanimous. It should be unanimous to change your
Yes.
bylaws. I belong to associations, and you
Dr.
cannot change
Henry?
the bylaws without unanimous.
Your current bylaws do not require a unanimous vote.
Yes, Jen.
Mr.
We
Pig,
should not be voting on anything
Mr.
until
Prater,
Yes.
change bylaws without a unanimous vote
Ms. Davis.
by our entire board.
Ms. Davis, your vote, please.
I vote no.
Okay. Section 1's approved.
I make a motion, we approve section 2, meetings of the board.
You guys should be ashamed of yourself. You really should.
You're the person who should be ashamed of yourself.
No.
These meetings
No.
prepared
When
and ready to go.
people
As a board member, you are not doing your
We
duty.
expect them to serve for
You're
4
not doing
years.
your duty, Miss Davis.
You should not have any.
Everybody else here is ready for you. You're ready for this. You're not
We
doing your
have,
job.
we have
And
a
I don't care.
motion to
As long as
approve
that board
section
member is
2.
taking care of what they're supposed to take care of, you
Can I have
can't
a
just,
sec-
if you don't like somebody, try to have them removed. That's
It has
ridiculous.
nothing about
That's-
life. It all has about duty.
I want to know, what are
Can I
the
have a
conditions?
section to approve, section
Read the
2?
conditions before we
Second to
vote on
approve.
how you can remove somebody. What do
Miss-
they have to do before they can
Motion
be
to approve
removed?
section 2, please.
All right, roll call vote, please.
Mr. Deal,
Yes.
Dr. Henry,
Yes,
Mr. Prater,
Yes.
Mr. Pig,
Yes.
Ms. Davis.
No.
Okay, that's approved 4-1. Section 3.
James?
I make a motion to approve section 3, fiscal.
We have a second.
I second the motion.
Okay, any discussion on that? Okay, could you call roll call, please?
Mr. Deal,
Yes.
Dr. Henry,
Yes,
Mr. Prater,
Yes.
Mr. Pig,
Yes.
Ms. Davis.
Yes.
I make a motion, we approve section 4, operations and administration.
I second that motion.
Okay, thank you. Any discussion?
I'd like to know what's in there. If Christie could reiterate on what's in that particular.
In section 4, the only change that we made was to, where it said chairman, we made chairperson. We just made those gender neutral roles.
Okay. Can we please do this for each one so that you generalized everything at the beginning. Before we vote on each section, please let us know what's in there.
Okay, well, we've been doing that because everyone has read it. So section 4, you already described that. Anything else? Any other questions? Okay, a roll call vote on that, please.
Mr. Deal,
Yes.
Dr. Henry,
Yes,
Mr. Prater,
Yes.
Mr. Pig,
Yes.
Ms. Davis.
Yes.
Section 5, I make a motion, section 5, to approve this for prohibition against harassment, discrimination and retaliation. This is apparently a new section. Reporting, and underneath this is reporting procedure, comma, complaint management, comma, appeal process, comma, definitions of prohibited conduct.
And it
Okay,
looks
we
like
have-
it also identifies a compliance officer or appoints a compliance officer. I was just wondering if the compliance officer is determined by the board or by the director.
The compliance officer will be determined by the board.
Thank you.
James,
For further discussion, Chrissy, could you please read that to us? That section,
Read what to you, Ms. Davis?
that section that we're getting ready to vote on.
James,
Or at
I'm
least
sorry.
go over it in general.
Okay, well, it is what Mr. Pig said. It includes the reporting procedure for individuals who believe that they've been harassed or discriminated against, or retaliated against. It talks about how the complaints are managed as far as how they're investigated, how the complainant receives a report as to the allegations and whether or not they are substantiated at the conclusion of the investigation, who they can appeal the decision to, where they can go, both statewide and from the federal perspective, and defines what are prohibited conduct of the board.
And what is the prohibited conduct of the board?
That you cannot discriminate against an individual on the basis of race, color, national origin, age, sexual orientation, religion, national ancestry, or genetic information. It mirrors your employee handbook, but your employee handbook only applies to employees of the department. This actually applies to anyone that interacts with the department.
Okay.
It is
Any
something
other-
that you're actually required to have under federal and state law so that you can make sure that you have the procedures in place to exercise an affirmative defense in the event that you do get sued for discrimination or retaliation.
Okay, back to the one that you guys passed that I didn't want passed. Just curious, what's the
Move to call the question.
process if someone is so to speak brought up that quote you guys want to get rid of? So what's the process?
Ms.
Who
Davis,
determines that?
you're totally
what's the,
mischaracterizing what this is about.
fair and impartial process?
That's correct.
To,
You're
to get-
you're mischaracterizing that totally. And
No, we might be a perfectly honest board, but what about the future boards? And what about if they're targeting somebody that's a decent board member, and the people love them, they elected them in there, and that certain board members just don't like them? Come on, let's be real.
we've already voted on that. Okay, so we're on section 5.
I made a motion for approval.
Yeah, and James seconded, is
Seconded.
that right? Okay.
Yeah.
We have the roll call vote on 5, please.
Mr. Deal,
Yes.
Dr. Henry,
Yes.
Mr. Prater,
Yes.
Mr. Pig,
Yes.
Ms. Davis.
Yes.
Make a motion we approve section 6 bylaws, rules and regulations. Underneath that, it is clarified the role of the board in adopting rules and regulations, required website publication once the bylaws are adopted.
So what does that mean? It's going to be published for the public to see?
Let's have, so we have a motion. Do we have a second on that?
I second that.
Okay. Christy, do you have any comment on that description?
Sure. So basically what this did is it said that whenever you develop the policy, you can solicit the opinions of or input of the community. So it allows you to reach out to experts whenever you're trying to draft regulations and policies of the board. That it gives the board the authority and outlines what the authority of the board is to adopt those rules and regulations, and then requires that once they are adopted, that they be publicized on the board's website. So for example, once these bylaws are amended, they will be uploaded to the website of the health department for the public to be able to see. And that requires that the board reviews the policies and regulations periodically to ensure that they are still, number 1, necessary, number 2, compliant with federal and state law. In the event that they are no longer compliant, you need to update them.
And when
Great.
you say board, you are meaning the board as a whole, not any individual board member, correct?
Correct. The board as a whole. An individual board member doesn't have any authority to act on their own. It's the board, as the majority of the board is the will of the board.
Okay, any other discussion on that? We have a roll call vote, please.
Mr. Deal,
Yes.
Dr. Henry,
Yes.
Mr. Prater,
Yes.
Mr. Pig,
Yes.
Ms. Davis.
Yes.
Okay. So that finishes up the bylaw discussion. And I believe we have some issues for closed session, correct?
I make a motion, we go into closed session pursuant to 610.021, sections 1, 2, and 14.
I second that.
Okay. Hearing no discussion, all in favor of going into closed session, please say aye.
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 Any opposed? Okay, so we're moving to closed session and we need to notify